So I used to be very active.
Okay.
Always had so many things. I was always doing many things, very active. I love moving, so I would run, I would swim, I would bike, yeah. And I think, I don't, maybe past 3 or 4 years, I was getting really tired. Like, I need a nap every day. Like, and the naps were getting longer and longer, maybe go up to 2 hours. And then I wake up and I feel just so bad because it was too long a nap and it was in the afternoon. And I thought, oh, it's just the heat or it's getting older. So I didn't think much about it. I just thought that this was just something that happens to most people. Like, why am I lazy now? I didn't know. And then COVID happened, stayed at home, and I think it just got worse, like stuck at home. And early this year, I got COVID. And when I got it, it was quite bad. I was throwing up, I had diarrhea, I had feet. Yeah, it was just not a pleasant experience. Yeah, it was really obvious during the MCO period because I was staying at home.
Okay.
I wasn't doing much. I wasn't going out. And yet I was still tired. Like, I told myself, right, I'm staying at home so I don't have to have a nap, right? I was having ample sleep at night. Why do I need an afternoon nap? There's no reason why I need it. And yet every afternoon, right after lunch, it's just like a crash. Like, that was the only thing I could do. But I didn't think that was a disease. I guess I was not aware. I just thought that was getting older.
Yes.
Or the heat, you know. How do people do it, like not have a nap? How do people continue the whole day? And then when MCO was lifted, I got COVID. Okay. And the whole COVID experience wasn't good, and I threw up the whole night.
Okay.
So
Suddenly,
okay. Out of the blue, I just kept throwing up. And then the next day, I felt very sick, so I tested. I did a home test and it was positive.
You did a home test?
Yeah, then I went to the clinic and I did a PCR test to confirm and it came back positive. So I knew, oh, I have to quarantine, I have to stay home. Okay. So I did that and I stayed home for about 2 weeks, right? And like during that period and after that, I had a really bad brain fog, couldn't concentrate, and I never had migraines prior. I'm just someone that never had migraines, right? So I was like, oh, what is this feeling? Is this a migraine? Is this, yeah. And so when I had a brain fog and it didn't go away, I said, all right, in the past many years, I think, yeah, I've not done a full medical test. I've not done anything to check on my health. So I asked around and a friend of mine, a cancer survivor, recommended Dr. 𝗖𝗢𝗪𝗜𝗍𝗓. And she just said, it was a very short conversation. She just said, oh, he's not a normal GP. Because I did not want to go to a normal GP and get medication because I just felt that would treat the symptoms. But if that was the case, I don't mind just, going through it myself. I didn't feel like I needed to eat something to just suppress the symptoms. Yeah, I could still function. Of course, not to a high degree, but I could still work. So I didn't want a GP. And mostly because I didn't want to take medication. Okay. Yeah. I mean, we're so used to going to a GP, right? When we don't feel well, that's mainstream behavior. And the GP just gives, most of the time, Panadol, paracetamol, antibiotics, a whole suite, like a whole bag of medication. And I guess I didn't want to take it because I don't think the medication does good things to our bodies in the long run. Yeah, correct. And I felt that if I'd rather heal naturally than to heal using something that would do me more damage in the long run. Yeah. But then, having said that, again, what I had I could still function. Just not at an optimal level. And I was just like pulling through the day. And then, yeah, so it wasn't optimal, I knew that. But I didn't want to take this medication because I didn't want to do, it felt like I wasn't helping my body, I was just suppressing what I felt. So I didn't want to go down that path, yeah. So when she said, oh, Dr. Lee is a bit different, and when you come, you do this preliminary assessment, they look at your blood cells, and then he will, based on that, he'll tell you what he thinks you should do. So I said, oh, very interesting. So she told the trainer about this, and then we were all talking about doing a medical after COVID and just seeing where we are. So I thought, yeah, that sounded like a good idea. And I haven't done one during the 2 years that we were staying at home.
Okay.
So I said, oh, okay, so Dr. Lee sounds interesting.
Okay.
And also his approach sounded interesting to me. Okay. So I knew, she was saying, yeah, he's not a normal GP. Okay. So that sort of piqued my interest. Okay. Yeah, but we might talk about this a bit later as well. I had other friends going to other holistic doctors at the same time.
Yes.
But why I decided to come here was after she told me about it, then I went on their social media and I saw a number to WhatsApp, and immediately I could contact and tell them what I was interested in doing, and they were very prompt in replying me, and it was very professional. Like I got a call and we had a conversation over the phone, so I felt, oh, this was, yeah, they were very structured, they were very professional. Yeah, I think I should come and check it out. Okay. So I messaged and I made an appointment to come. So like you said, we did the preliminary test, and we did the red blood cell test, and I could see my red blood cells were very sticky. It was just not moving, there was no flow, and I was like, oh, that's exactly how I feel, I could see it in the machine. Then I had a discussion with Dr. Lee, and he prescribed nutrients, but then he also told me, you've got to see health as a big picture, so this is just one aspect. Nutrients and lifestyle changes are just aspects, but there's more, you've got to take a big picture view. So I thought, oh, very interesting. And then he also said, here he looks for the root cause, right? He doesn't treat the symptoms. He looks for really why. He said there's always a reason why certain things happen, which was not what I've heard from doctors before. Normally they just prescribe something to treat how you feel, but they don't go after the root cause. So I was thinking, oh, that's interesting. Like when I first met him, he did things which I did not expect. Like he took pictures of my teeth, right? And I'm like, what is this? But later I came to understand it was because he was taking a holistic view of my body, of where I was coming from. He was trying to understand, of course, everybody is different and everyone has years of history, right? Yes. But he was trying to understand my body. There was a questionnaire, it was very thorough. And I think during the conversation it came up, I said, oh, I'm tired, I sleep a lot in the afternoon. Of course, I thought that was normal. I didn't think that something could be done. And then he said, oh, we can look into that. I think we can address this. And I was like, you can? So I was very hopeful. I thought, wow, he can address the tiredness, which I was surprised and very hopeful. Okay. Yeah, that was the first time I thought, oh, something could be done. Okay. It's not just getting old. It's not just, it's not, like you said, hormones. It's just, it's something can be done. It doesn't have to be like this. Okay. So Also, it made a lot of sense to me. Okay. Yeah, everything he said made sense because things don't happen. There's always a repercussion of what you do, right? So when he spoke about addressing things holistically, it made a lot of sense. Yeah, I think I can work with this approach. Okay. So I I really haven't met any other doctor that took this way of trying to heal.
Yeah.
So then it made sense, oh, that's why they're called heal within and root cause. And yeah, and I totally understood when he said he would just prescribe, but then it was up to me to go home and stick to what he recommended. So I think I was sitting outside, I was thinking, oh, do I want to do this? If I do it, I will commit to it.
Yes.
And if I don't want to do that, then just go find someone else.
Yeah.
So I said, okay, yeah, let's commit to it. Let's really try to do the best that I could.
Yes.
And just see what happened.
Yes.
Yeah.
Okay.
So that was why really I decided to continue. So after the first consultation, the preliminary consultation, he put me on a nutrient therapy. So it was supplements. It was very comprehensive, and I had to come up with a schedule, like, okay, how do I eat this twice a day and make sure I get everything right, because yeah. So I did that, and then the subsequent month I came back and I did a full medical test. And while doing the medical test, he taught me about toxicity.
Yes.
Yeah, how people, like he said, you've had all this work done on your teeth, and some of it was mercury.
Yeah.
I had like six amalgams filling, so 6 teeth with mercury, and he was like, kept saying it's so eroded, and I knew it was eroded because they've been there for years, and I'm a teeth grinder. I grind my teeth at night, so the poor teeth have been worn out, right? So I knew it. When he said it, it wasn't new to me, and I thought, oh, okay. Then he said, do you know that you probably swallowed it, and this is toxic material in your body? And I thought about it. I was like, yeah, it sounds very possible. It sounds logical. And then I went back and I did some reading. Of course, Dr. Lee explained it. He showed me videos. But I said, okay, I want to go back and I want to do my own homework.
Good.
So I went back and I did my home. And there's so much, if you start looking, so much material online. It's not mainstream, but there are a lot of, especially in the Western world, a lot of medical professionals talking about how toxic elements in our everyday lives can come into our bodies and cause illness. And so I asked Dr. Lee, I said, okay, on a scale of 1 to 10, how bad is it? And immediately he said 10. So I was like, okay. So I said, okay, fine, I'll go to a doctor, a dentist.
Yes.
Right? Because I knew I had to do it anyway, so I might as well just do it, in a way that would cause less harm to my body. Take out all the mercury fillings and replace it with non-mercury fillings. I knew I had to do it. So I told him, I said, I'll do it, and he's like, you don't want to think about it? I'm like, no, I know I need to do it, so I'll just do it. So they fixed up an appointment with the dentist for me.
Yes.
And so I was like, okay, don't give me time to reconsider, just make an appointment and I'll go. So I went and got it done. But and this is where I think Dr. Lee's a bit different as well. Like, he's very he really believes in this, that this, especially mercury is a toxic element. It's really shouldn't be in our bodies. So he had a protocol. Like, if you want to take out your amalgam fillings, you have to do it in a way that protects you, because it's such a poisonous material. So he, before I went to the dentist to remove it, he told me, all right, so this is what we're going to do. This is how we're going to make sure that that you don't absorb any of it when it's coming out. So that was my first, I think they call it IV therapy with him.
IV chelation.
Yes, correct. Yes. So I had to go through quite a bit of it because I had 6 amalgams to take out, right? And some of it were on molars, so they were like huge. So I couldn't do a lot at one go. I could do a little bit, then I'll come here and do the treatment. then the following week I'll go take it out again and come here and do the treatment. So it was a pretty long process. But somewhere during the course of this process, my medical results came back, the blood test came back, and I did quite a comprehensive test. And my heavy metals in my body, it was like all red. It was like I surpassed, I way over the mean. Okay, I was overachieved. It was extremely high red scores. Like there was a lot of heavy metal poisoning, a lot of heavy metals in my body. I did not expect that, right? So, you know, I had a follow-up meeting with Dr. Lee, and he pulled it out and said, look at this, it's all red. And it would explain why my free radical test was always also, I was always hitting the highest score. Like there isn't a higher score, you know, it's already, So he said, unless you've been eating a lot of fish. And I was like, I haven't eaten, you know, I was vegetarian for over 20 years. So it had to be, so I knew then that it had to come from somewhere. And it was probably, he was right, it was probably my teeth. So then of course I asked him, I said, why can't I just go to a dentist and get it taken out like what my friends were doing? And so there's a lot of education. He's like, yeah, you probably swallow it if you know, when they're drilling it, the vapors are coming out, and that's poisonous too. So yeah, so I think I had to go through 3 rounds. So it was about 6 weeks of coming here and doing the IV therapy every other week. The detoxification, yes, but that was because I was going to take out my amalgam. So we did a detox before, like it was just part of the protocol. So it's something to take in the morning and at night, and throughout the day you take like a lot of charcoal pills and a heavy metal detox pill at night. Yeah, in the morning and at night, a heavy metal detox pill, and then these drinks to drink in the morning and at night, and then a lot of charcoal during the day.
Okay, that was 3 days.
So it's a heavy it's a little bit complicated, but they have a protocol. So for 3 days I do that. Then on the 4th day, on day 3, I start coming here to do the IV treatment. And then I do IV treatment for 3 days, 3 consecutive days, and then I continue with this another 4 days. So it's like a week. And then I repeat the whole thing the next week again because I had so much amalgam to take out. Yeah, we had to work together. And they would remind me like, okay, so when are you pulling out your teeth? So let's say I was going to get, no, not pulling out, that was taking out the mercury, the amalgam. So that was Monday. So then the Friday, the week before, I would have to start doing this heavy metal detox. And then continue for 3 days with the IV treatment once I had the amalgam removed, and then continue with the heavy metal detox.
So what you started with nutrients. You were taking that nutrients all the while.
Yeah.
Yes. And then you directly went into the dental work.
Yeah. While waiting for my blood test results, I decided, because I had to do it anyway, so I started doing the dental work. The blood test results took a few weeks because it goes to different countries.
Yes.
And when the results came out, it was, it just sort of, it was evidence to just supported, the decision to do the dental work was right. I think Dr. Lee wanted to look at the results before he would prescribe other therapies. But he did recommend lifestyle changes, like exercise, getting enough exercise.
That's your everyday thing anyway.
Yeah, well, I wasn't, because I was feeling so lethargic, right? I wasn't doing much of it. In fact, I was I wasn't enjoying it anymore. So it was a chore. It was like, I had to drag myself to the gym to do it. So we talked about it. He said, you should continue. And so I was like, yeah, okay. So I made it a point to go.
Got it. So your lifestyle was exercise. Besides that, anything?
Oh, the veggie blends. To do the veggie blends. So I did those. An energy stimulant. Yeah.
Any powder?
Like an energy energy
Yeah,
thing. Yeah.
So you put in the drink and then you make. He gave you that.
Yeah.
Okay.
Yeah.
Okay.
So after I got the blood test, he tweaked my the supplements that I was taking. But everything else was kind of good. Okay, so hormones were a bit not good. I mean, I think because probably will go through menopause really soon, and hormone levels were really low. But he said, let's try the nutrients first, and then we'll see if we need to do anything there. So I thought, okay, yeah, let's do that. But the most compelling thing, the most urgent thing to work on was the heavy metals in my body. And he said, once we address that, you see how you feel. Okay. You know, you see if you feel better. And because I saw it was all red, right? Yeah. So I was quite motivated to focus on that. Right. So besides the IV therapy, yeah, I think, yeah, then the heavy metal detox. So I think a month right after I first met Dr. Lee, I did like a monthly checkup, and they do the blood cell, they look at it again, and it was looking much better. So I was pleasantly surprised, and that it worked so quickly, right? So I was telling Dr. Lee, you mean just with supplements, it can improve? Yeah, and he's like, yeah, it can. So so that was something that I could see. In terms of how I felt a lot better. I didn't need my afternoon naps. I mean, like, I just didn't need it, right? And then some days in the evening, I'll be like, wow, I could go through the whole day today, like, non-stop, and I felt fine. The tiredness, I think, was caused by the heavy metals, because I don't have that anymore. In fact, my body weight hasn't changed, but I'm feeling lighter, like I feel lighter, which is strange, it's hard to explain, but that's how I feel. So I'm not sure how it worked, but I think having gone through the protocols and the therapy, something has changed. So I'm not as fatigued. That's obvious to me. Going back to the gym, in fact, like at the start last year, like I was pulling out of certain exercise classes because they were getting too tough. But now I've gone back and I've joined these classes, and so everyone in the class is a lot younger than me, and it's really hard work. But yeah, I've come back and I've joined them. I'm like, okay, let me train with you, right? So I'm not going to compete, and this was something I really thought I had to give up. So yeah, so I've started joining this cycling group, going with them and training with them, and it's hard work, but I'm enjoying it, and I can do it again, which was I actually thought that, okay, that part is over, that part of my life was over. And at work, I think definitely the quality of my work has improved, mostly because I'm not so tired. And when I'm not tired, just my thoughts are more positive. And that has been something that I've noticed. Like, when I was tired, everything was a challenge, like whatever challenges that popped out, it would be like, oh, I can't deal with this now. And now it's not a challenge anymore. Like, immediately when something pops up, I don't see, oh, this is something I have to deal with. I'll be like, oh, let's see how we can make this better. Or I don't even see it as a problem. So that was very interesting. And very positive. And I was telling all my friends, and they were like, oh, then it's worth it, right? And I'm like, yeah, I guess it is. Oh, the brain fog was gone, like within a month. And when I should have mentioned this earlier, when I met Dr. Lee, I had some eczema, which I've had for years, right? But because of MCO, I was at home, and it sort of got better, but it just reduced to one patch which won't go away. I was there, and I was like, oh, you know, this is here, and then before COVID, it would like get bigger, and then it would spread. When it was big, like sometimes I had to use steroids because I just didn't want it to get any bigger, but it never went away. So when it reduced, right, I just kind of left it, and I would put all this really expensive cream hoping that it would do something, but it never went away. So I just moisturize it, but so it won't get dry and painful, but I just basically left it. So I just showed it to him, like, you know, like had this, but I said, oh, it improved so much. But I think with the nutrients, it just went and it hasn't come back. Like, I completely forgot about it. And I've had it for years. So that was very fast. Yeah, the eczema going away was very fast. I'm very, very thankful. And I think I had, I can't even remember because it's, like my skin just wasn't healthy. It was dark, it was just looked tired, fatigued, and all that went really quite quickly. I think it was the nutrients, yeah. Also, since we're talking about skin, I remembered I used to be very dry. I was talking to Dr. Lee, and he would, with a cardigan, right, and I'm all covered up, and he would say, you're very dry, your skin is very dry. And I'm like, yeah, it's been dry all my life, since I was a little girl. I thought that was it. And I mean, it's just skin that I was born with. You can't do anything about it. So, we can do something about it. And it has, I used to have to moisturize twice a day because it was just dry, and I could actually feel it drying up. And now I don't even moisturize every day. Yeah, when I first came, like I would sit here with a cardigan because I was cold all the time. The minute I was in air conditioning or in like a shopping center, I'll be cold.
Oh. Now?
No. Now I'm okay. Yeah, I'm not as cold. Yeah.
Okay.
Yeah.
So that one is.
Yeah, I think the big thing that I learned here was like I mentioned, the toxic elements in your body. Like for me, it was in my mouth. It's not mainstream information. Like if you go to a dentist, they probably won't tell you. About mercury or about root canals. They won't tell you the possible effects. So I had no idea. And even someone like me who, I was a journalist for many years, so I do a lot of my own research. I never came across information on it because it's just not mainstream, you know? But when I had COVID and I was staying home, I read up, and then I was like, why have I not come across this before? Because there's actually so much research done on it. But it's just not commonly talked about, you know? Yeah, so that was one thing I learned. Nutrients, so everyone knows that you should take your vitamins and your supplements, but a big reason why people take supplements but they don't see any results is because maybe they're not taking it consistently or they're not taking enough. So I learned that sometimes when I'm talking with friends and they say, oh, I take it, but I take this vitamin but nothing happens, but chances are you're not taking it consistently or you're not taking it enough. So it's not just taking it, it's being quite regimented about, being quite disciplined about it. Yeah. What I learned, so I'm quite conscientious. Like I would cook and eat my own food most of the time. I was very conscious. I cooked and I kind of ate clean because I cook and I eat. But that doesn't give you everything that you need in terms of supplements. You still need to take certain supplements. I can give you an example. Let me think. Or like vitamin C, right? Yeah. Like I mean, this is also with Dr. Lee's education, like so many types of vitamin C's in the market, right? And I knew it was good, but I could never digest them well. And because I couldn't digest them well, I just didn't take them. So he explained to me about vitamin C, and he said, oh, I've got this vitamin C, you take it home and try. So I bought it, and I absolutely love it. I mean, when the second time I had COVID, the minute I felt like a fever was coming or I just felt congested, I would take the vitamin C, and in 2 hours, I felt good.
Really?
Yeah, so I buy it. I don't just buy one bottle now, I buy like 2 or 3 because I like it so much.
Yes,
yeah,
yes.
yeah.
Okay.
At the end of the day, you have to take ownership, right? Your health is your life, right? It's your life, right? Doctor just does his part, but then you have to take ownership over. So when I decided to commit, like when I decided to pursue this path with Dr. Lee, I said, okay, I'm gonna do what it takes. So even the supplements, I mean, that was a big, like I had to insert it into my lifestyle, you know, I had to get a pill container and like, okay, this is, I mean, they make things very clear what you have to do, and you can follow up at any time, but then you have to go home and do it. So I actually had to tweak, like I had to get up about 20 minutes earlier so I could make my veggie blend, I could get my supplements, you know, and then they give you, like ideally you take this energy stimulator before you go to the gym. So I was like, oh, that makes sense. So then I had to remember to do it, right? So you have to take ownership. You have to be a bit open-minded too, because when I was at home and you know, I couldn't go out, it's like, oh, let's just YouTube it. Let's just see if there's a medical doctor or a podcast that's talking about this. So I think what worked for me was I was also a bit curious. I wanted to find out more. I wanted to find out if other people were talking about it. Why is it not mainstream? Why is it no one else is doing it? So I have that healthy curiosity, I think. So you have to be open-minded and curious and take ownership for it. Yeah, just, I mean, the complaints, we had so many years of doing that. So it doesn't take you very far. So just do it and see what happens. And I think if I did it this way, if I took ownership and I committed, then it's very interesting to see what happens.
Yes.
Right, yeah, so that was the approach I decided to take, yeah.
What about the support given by the team? Did that have any
that was fantastic, yeah. So I mentioned that I've got friends going to other holistic doctors because I think there's some general awareness that just a normal GP, they're good for certain things, but they're not good for everything. So I had friends going, and sometimes we talk about our different experiences, and with them they had trouble even scheduling appointments, trouble following up if they have let's say they're doing vitamin C, they had trouble or even getting their supplements. You know, it wasn't timely, and then because it's not timely, then they just stop because it's too much work to follow up. But I never had that experience here. I mean, here they were very passionate about what they do, and they're very passionate that you know what to do, and so I always felt supported, you know. And sometimes I text them on a weekend at night because I just like, oh, I can't remember, I had to do this, you know, I had to do this sequencing, you know, and they would always reply. So I felt bad. I was like, oh, I'm so sorry for texting you at 10 at night. But they would always reply, and it was never a big deal. So I always felt very supported. And because they were so vested in me getting better, I was also motivated to continue. Yeah, so the support here is really good. They're very professional, I have to say, yeah. So I would tell them to look for the root cause. Yeah. That there's always a reason why they're feeling a certain way, and that something could be done, right? So I think I just had a friend go into SGMC for 3 days of tests, and it's still inconclusive. They still don't know why certain things are happening. So, and that's accepted as okay, you know, like that's how it is.
Yeah.
But I think they should actually investigate, like try and find out why, find a medical professional that's also interested in finding out why you feel a certain way. A lot of my friends also have post-COVID symptoms, different to mine or similar to mine, but definitely a lot of us, I think with the right assistance, things can get a little bit better. Yeah, you don't have to live with it. Yeah.